Okay, good afternoon, everyone. My name is Luciana Lalich. I'm the Research Impact Officer at the School of Nursing and Midwifery at Trinity College Dublin. You are very welcome to the very first session of our new seminar series, Research in Action, Shaping Policy, Driving Change. This series is designed to support researchers, especially those early in their careers, who want to see their work make a real difference by influencing policy and practice. We are delighted to begin with Professor Déirdre Daly, Professor in Midwifery at Trinity College Dublin and Director of the Trinity Centre for Maternity Care Research. Deirdre leads a landmark MAMMI study and national evaluations of maternity services. Her work has directly shaped policy at the national level. It has also driven changes in practice and influenced similar research across the EU. Without further ado, I'll hand over to Professor Déirdre Daly for her talk on influencing policy and changing practice through research.
Thanks a million, Luciana, and good afternoon, everybody. There's 40 plus people on at the moment, so thank you so much for joining us. We're expecting a lot more, but I'm going to make a start anyway in the interest of keeping in time. Today, I have the pleasure of being able to talk to you about how the maternal health and maternal morbidity in Ireland studies shaped practice and shaped, particularly more recently, policy. Now, along the way in the layout of the presentation, I'm going to put huge focus on women's involvement, and that's women who took part in the MAMMI study. The impact it had, the study and the research findings had on practice, and particularly the difference the research made for women, and what was really useful for health professionals. And then finish off with what policy, if any, has changed, and it has changed, and what is continuing to change. As I go along, I'm going to stop periodically to reflect on what worked. And at those times, that's probably a really good time for you to have a think where you are with your own research or practice, what it is you want to change in terms of both practice, service, policy, and ask me anything that's relevant, directly relevant to you, and I'll do my best to help and answer. So let's start with the context. Women birthing in Ireland. So I was a practicing midwife. I was lecturing here, and I was also a practicing midwife from 2006, 2009, 10, but it was 2009, 10, I started thinking about my PhD, and I was still practicing at an antenatal clinic out in one of the community areas. And a woman came to me and told me that she was very well during pregnancy. And she came back for a second visit, and she told me she was really well. And she came back for her third visit and then started crying. And we were fortunate to have that relationship. And she told me that she had leaked urine and leaked feces from her first baby's birth 2 years ago. She also told me that the health practitioner that she had seen quite early on in her postpartum care told her that these things happen. So I went looking for data on women's health postpartum in Ireland, and we don't collect or report any at all. So we have no idea about the women's health during or after a pregnancy once they leave a maternity hospital. And at the time this was going on, there was about 70,000 women birthing in Ireland. There's now about 58, 60,000. But we don't know what's happening to those women or what has happened, legacy of the pregnancy, birth, and any interventions that may have occurred. In fact, the legislation on the focus moves to child health surveillance. So that was the context. And this is what I set up for my MAMMI study with massive support from my supervisors, the wonderful Cecily Begley and Mike Clark. And it was a longitudinal study set up to identify the existence, extent, and severity of maternal morbidities in nulliparous women, first-time mothers, during and after pregnancy and up to 1 year postpartum. And that was important because we know that prevalence will change and incidence will change, and some women will get better, some women will get worse. It'll persist for others. So it was set up very much as a longitudinal study. It was also set up as a mixed method study, and this bit was important to conduct one-to-one interviews with women on their experiences and to collect data from consenting women's maternity records so we could compare women's recollection and their records. So this is what the study looked like in 2011 when I set it up. And today I'm going to talk a lot about I, but it's mainly we, because what has really made a difference is not me on my own, but this. The team of researchers and absolutely brilliant people that developed and conducted parts of the study and contributed to all of it. So this presentation is for every one of these people. The study was also set up to be research with women, not just about. And that is a philosophical mindset in how you conduct research and then what you do. It was ultimately about deepening our understanding about maternal health problems, but first of all, learning if they did exist, and then finding ways of strengthening the maternity services to support women, because the research's primary aim was supporting women and helping women understand. Now, at this stage, I'm a really young novice researcher. I'm thinking about policy, I'm studying policy, but in my head, I'm not thinking about impacting it yet. That was different. I wanted to do something to help women. So today I'm going to talk about involving them from the start, engaging with them, co-presenting with them, co-developing sources, co-conducting, co-publishing, and then all of that coming together to make the real difference and influence policy. So involving the women from the start meant that before the surveys were administered, and these surveys are 60 to 80 A4 pages long, there's 5 of them, and they're asking women about intimate, sensitive questions about their health and their personal relationships. So before I started the study, we went out and asked women, what do you think of it? Would you answer this survey? It's long. Could you commit to it? Are the letters written in a way that would make you feel you wanted to take part? Again, this is research with, not about women. This was really critical in getting through certain research ethics committees quite easily. About 20 plus women wrote, and this is what they all said. You have to do it. It'll give women confidence to speak about issues that pregnancy and birth can influence, topics that are taboo. That shaped research ethics committee decisions, who would have said that this is too burdensome for women. Women also said, these ethical issues, women also gave advice on how to deal with these really challenging issues. What would we do if a woman said that she had suicidal thoughts? Or that she leaked feces? Really serious health issues. The women said to me, we're intelligent, put sources of support and leaflets in your surveys. We'll be able to find them then. Another issue, what about women who are suffering from violence at home? How will we respond? One issue that came up later on when the surveys were done and they were being administered was a woman had said, insert a duplicate detachable page for women to save separately, so they can put it in their pocket and the survey looks untouched. They talked to us about engaging with them throughout. If you say these are our data, what are you going to do? How are we going to stay informed? So we set up a website. We set up regular newsletters. I think they were quarterly or every 4 months, and they were short. They were just about what's happening now, a little update, etc. And that was all the women wanted really at the time. And we gave them updates on recruitment, and we gave them an update if there was any findings emerging. This, I think, was a real turning point for me and for us as well. And this is this philosophy about the study. These are women's stories. These data are the women's data. All we're doing is minding it, analysing it, keeping it confidential, and sharing it with the scientific community and back with women. So we hosted sharing the findings seminars with women in all 3 sites that we had recruited from, and this happened over time. And inevitably, the women said, you can't present those findings and do nothing. You have to get them out there. You have to do something. You have to do something that's going to make a difference. Round about this time, we started co-presenting with women, and this is Sive, one of the women in the study, who co-presented, probably our first co-presented presentation, and it was at the Health Research Board One to Watch conference. And I'm delighted to say, thanks to Sive, we won the Health Research Board's inaugural One to Watch award. So the women are featuring more dominantly in the study, and they're beginning to really make a difference in loads of ways. We hosted a lot of scientific conferences, international conferences, and we attended other conferences. And from then on, every conference we held, the women spoke. And often they were the first to address the audience, or they addressed it periodically. I can tell you, when the audience, or when we broke for anything, those audiences, and there were health service providers, managers, etc., they were talking with the women, not with the researchers. They wanted to hear the women's stories. And it was the women that were really saying what it was like for them to come through our maternity service. This is another presentation that actually had a real influence and impact on researchers that were there. So Naomi travelled to the UK with me to present on one aspect of the study. And for this presentation, Naomi was the one that introduced me, introduced herself as a participant, introduced the findings that we were learning, introduced me and the findings that we were learning from the all of the women in the study, and then concluded with what women are hoping will be achieved. That was powerful. And there was most of the researchers in the room at various different levels say, I will always do my best to include women. Ellen has been really instrumental in presenting and authoring with us. And she was a woman who described the study as unleashing the social activist within her. That all of these pieces that I'm telling you are going to come together shortly in terms of the influence. And we also had other seminars, and everywhere from then on the women presented, and they were central and leading it at many times. And this is what they started doing. So the media, these findings were coming out into the media regularly, and it was the women who were talking about it. And the papers were taking the information and they were generating headlines like, first-time mums don't know what's normal, they're silenced. And this is all the same things that we were learning from the women. These are the words that the women had been using, and they were now getting into the papers. And they were getting into the newspapers and the broadsheet media and other fora as well, because women were giving the interviews and women were talking. It wasn't me or my colleagues talking about what we said or what we found. It was we saying, this is what we've learned from women, but the women themselves were talking. And they presented in the media on things like the Ray Darcy show with Catherine and morning TV AM in the morning, and they were always there leading and up front. And it was fantastic having them. And that began, when we began to look at this and look what was happening, and the wonderful Yolanda was a TCD communication team member here in Trinity, and she built a media book, and you could see what was happening over time, that there was all of these constant drip feeding headlines, women having unmet health needs, suffering in silence, beginning to say stopping maternity care at 6 weeks postpartum is far too soon. It's unrealistic. They don't know what's normal, and they don't know because we're not telling them. So I want to stop and pause here for a few minutes. And this is a good time for you to think about what I've said about women's involvement, where it might impact your work or have relevance with your work. And say, the study started in 2011-12. We're on to 17, 18, 19 now, when we're sharing the findings with women and the media and all of that. And over, particularly from 14, 15, we got an awful lot of media cover about the findings and publishing them in scientific publications when the team was growing, but also in broadsheet media and particularly newspapers, again from the women. That generated momentum. That generated talk. It generated talk amongst women, amongst healthcare professionals. But for the first time, it was really saying, here's a country that don't collect data on women's health postpartum, so there's a silence. If there's a silence, women don't know what's wrong. We're not telling them what's wrong. Everybody presumed the woman is fine. The labour and birth is over. That's not women's experiences. And it was really generating momentum in breaking that silence. Now, 17, 18, in some places there were services for women, but not everywhere. And it was very much a postcode lottery. The other thing that we were doing is having regular meetings with women's groups to share the findings and remind them, this is what we're finding from women, but also to convey the message. These health issues are not normal and can be treated. So again, the core, research with women, enabling women to get help when they need it, so that these health problems don't persist and become chronic. There was also something else that we hadn't anticipated, or I hadn't anticipated anyway, from the surveys. And that was that women commented on the surveys. So the surveys are 60 to 80 pages. They were in paper copy. Women talked about sitting down with a cup of tea, finishing it over time, maybe over several things, but it gave them time to stop and reflect on their health. And not just on their health at a point in time, but over time. They also, the questions that were asked, many women said, nobody asked me this before. But if researchers or someone is asking me this in this survey, it must be important. So women who were leaking urine or feces said, I will get help now because I read it. So in an unanticipated way, The findings from this paper suggest that the surveys themselves were giving back. So it became this lovely two-way process with the women. It became that real relationship. They were learning. Now, they shouldn't have to learn from the surveys, but they were. Another flip and change happened with our thinking and what we did throughout the study. And this is when co-development of resources with women started. So going back to the first sharing the findings seminar that was on here on a Saturday morning at Trinity College, we shared the findings, and a woman stood up at the back and said, you have to do something. You can't look at that level of suffering that's happening in women in Ireland and do nothing. You have to do something. We set up a group, PPI, Public Participation in Research Initiative, with the women. And when they came together, they said, we want to make a real difference. We want to have impact. You have to do something. So we put our heads down and we got together and we wrote grants, and we were rewarded 4 different grants in over 18-19, and altogether, I mean, it was quite a lot of money, but it was fantastic to get all of these to help us develop and co-develop resources. And these resources actually became far more than we had even anticipated, and they had wider influence and greater impact than we realised, than we anticipated. There was core contributors, these 5 women in the MAMMI study, and we were really very much looking at the MAMMI study findings, what we were learning from women and what the message was going to be. And this key message was not just about sharing these findings of women's ill health. It was thrive, not survive. And that wasn't our or my line. That was a line that was very much coming out from the World Health Organization's maternal health group at the time. Thrive, not survive, not just survive. Don't be putting up with health problems that could be treated. So we translated the maternal health findings into maternal health resources. And these resources were very much based around what women were saying, and that core team were saying, what I wish I'd known about motherhood, about postpartum care. The resources were initially developed in English and Spanish at the same time, and then we got additional funding to translate them into Dutch as well. There's about 4 hours of learning on the module, and this is a typical week, and it's structured with articles, resources, videos, interactive sessions, discussions, and a tip of the week or interaction from a woman and a woman's story. This we didn't quite anticipate, we hoped, but these resources have been accessed by 1,400 people in over 130 countries. That's massive. And if you were to log on and use it, you will see that from all over these 130 countries, women are saying the same thing again and again and again. I wish someone told me. I wish I had known. They're also used by all of the maternity hospitals and services in Ireland to complement their resources, not replace them. These are digital resources. They'll never replace the in-person midwifery care or doctor care or physiotherapist care. They're there to support. And in actual fact, what an awful lot of healthcare professionals are doing is using them, and you can access them bit by bit, but using bits of them to start a conversation with a woman or enable a woman to start a hard conversation by saying, if you want to talk about mental health, have a look at this video and maybe we can talk about it and how you're feeling about it next week. something like that. Same with fecal incontinence, pelvic floor exercise, urinary incontinence. So it's not just an access for women, it's an access for a health professional, and it's a resource for the two of them together to start conversations. I'm delighted to say that these, in terms of the resources, are now built into the antenatal education programme nationally. That means that every antenatal educator in Ireland who's delivering the service in the maternity hospitals or elsewhere is sharing these resources with pregnant women and their partners. That means one big thing for women. It's that there isn't going to be a silence around these health problems. They're not going to know. Women who attend those classes are going to understand these health problems are normal and can be treated from a very early stage. I'm delighted to say that it's also being used in the guideline for public health nurses nationally. Again, all of the resources are there for them to use, and they can use them in the same way to start a conversation with a woman. They're also, and this was with Cecily Begley's funding, they were also developed in Romanian and Lithuanian. And they're there, and a key part of our philosophy is that all of these resources would be free to all women. So nobody would be prevented from accessing healthcare data or healthcare information. And we were chuffed, again, not expected, but we were chuffed when we were recognised, well, not we, the resources were recognised by the Health Service Excellence Awards as being exemplary, which was great. This was another phase now, co-conducting research with women, and this has been a really, really great and positive experience. So again, the philosophy, their information, their stories, their involvement in research. So the women co-developed the follow-up surveys with us. The second baby, 6 months and 12 months, and the 5-year follow-up. And we were trying to find an area for the MAMMI studies were designed by me based on other studies from another country, but I didn't have women's input. This was very much what's missing. What do you want? And this is again 2007 to 2018. What do you want to see in it? And they wanted to see, and we went through the process of prioritising. We met quarterly, prioritised research topics, and then came back at the end to this, a general question. What really matters to you? This resulted in a co-publishing with women in the MAMMI study. And here's what we learned from the women about their health, postpartum care up to 1 year after the birth. Women talked about this pendulum of care, and we know it. Some women talked about gorgeous, delightful services. Others talked about services that were unacceptable. They talked about them being inconsistent. Not being able to get information was provoked anxious or some degree of anxiety. Everything that happened was all about the baby. And sometimes there was this information seesaw, so they didn't know where to find it, or they were absolutely overwhelmed with the amount. This was in the midst of this changing identity, magnitude of motherhood, grow into advocacy, and the whole weight of responsibility of motherhood. And this is what how they describe themselves in the very services that's supposed to be about them, invisible. We co-published in like the Irish Nurses and Midwives Journal, and that's deliberate because that means you're reaching virtually every public health nurse and midwife in Ireland. Susan Hannon, PhD student at the time, now postdoctoral researcher, did this gorgeous secondary analysis on these data. So again, you can see the shift from what's it like to what could work or what is working. And there was a couple of things that are three real themes that they talked about, and it was connections, relationships, the tone of care, postpartum presence of support. Now, keep that in mind there, concerned professionals and the services that women found beneficial. And flexibility for new families in terms of what's happening afterwards with paternity leave, maternity leave and all of that. The theme two there, the professional postpartum services that women found beneficial. And then Ellen finally has recently, and this is just out, co-authored a book chapter with us. So it is brilliant to have had women's input all the way. And this is where I want to stop again. So far, this is about influencing policy and changing practice through research. That's our title. So far, I've talked about women's involvement. And I can tell you, hand on my heart, that anything we did would not have happened without those previous processes. Everything from the start generated more and more momentum. By the time the Women's Health After Motherhood MOOC was developed, and yes, it was a massive online open course, but we were moving from a place of having no information, women suffering in silence, not asking about anything because they couldn't find any information on it and therefore they thought it was only happening to them, to having the MOOC and a resource that women could talk about and healthcare professionals could refer women to and use for women as well. And they talked about the benefit of having it. There was the regular scientific research outputs. Again, an awful lot of support from TCD's communication team to reach the media and keep the momentum going. Again, every time we could, we did regular meetings with women's groups, the likes of Kuju and stuff. I was also had the pleasure of being invited to present share them with maternity care professionals and invite to present them to the Maternity Directorate of Midwifery Forum. And this was the lead into saying to the hospitals, all 19 maternity hospitals in Ireland, here are these resources. Here they are, you're welcome to use them. They're co-designed with women. They're written in such a way that they have a life, a shelf life. The other thing I want you to think about and reflect on from your own perspective is what's happening in the wider national context. So MAMMI study started officially, recruited the first woman in 2012, and this is now 2020-21. Over those years, you will have known, and you'll know from the media, that there have been several inquiries into maternity services and women's health services. You all know about the cervical screening. You all know, you hear in the media about inquiries and investigations into particular hospitals and stuff, and that all creates worry for people. So that was the context, all of that was happening. But there was also something happening as well. Those inquiries and the way women were talking about the maternity services led the Department of Health to publish in 2016 our very first National Maternity Strategy. It's the very first one we've had on the island of Ireland, in Ireland, not on the island. It's the very first one we've had. And then out of that grew implementation group. Out of that grew the National Women and Infants Health Programme, who set up loads of different committees to look at different actions and different recommendations. Now, those committees and groups functioned in different ways, and they do function in different ways. Some of them were short-term, some of them were long-term. But from about 2018 till it really started, I was invited to join several of them, which I did. I was invited to present at others, which I did. And I want to raise something that I haven't said before, but this is fostering a relationship. And is fostering a trusting relationship between these providers who are getting the money to implement it from the department with you, and you sharing your findings. And the findings I'm sharing is what we're learning from women, not what I'm doing in research, what we're learning from women, what women told us. So these relationships and forming them and minding them. And minding them because you're professional, you're trustworthy, you have integrity, you have honesty. There's also different relationships, and this is something to reflect on in a slightly different way. So I've been invited to, and colleagues have, and I've been invited with clinicians as well, to present to the Department of Health, the Women's Health Task Force, various times, another forum. And these are simply short-term invited presentations. That's what they are. They're for an afternoon or a workshop or something, a short term. But they enable follow-up relationships and trust to develop. And over the years, I had really great relationships with staff in the Department of Health and in the Maternity and Gynecology unit. And great, and you build up that relationship and you talk about what issues and you find out what their priority areas are and what you can do together and help. The issue that I found challenging and difficult is that these people, these lovely people, they get promotion and they move on. So you need to start building new relationships. And that just takes time. That's life. It happens within the maternity services as well. And the other thing in that context is you could be progressing beautifully on a particular topic and then a priority changes. The topic changes because something has hit the media or the Joda, what used to be the Joe Duffy show, something has hit it and another issue takes precedence. The department then set up the Radical Listening Project, and this was happening separate from the maternity care strategy, but covering a lot of the same topics, women's health. Listening, and inviting women in and listening to them. And I'm delighted that the evidence that we had amassed over the years and the research had contributed to the evidence in Ireland, because there was nothing else on women's health postpartum. Absolutely nothing else. Then things changed. The first time, led by the Health Information and Quality Authority, 2019 it was conducted, was the first National Maternity Experience Survey. Now, this is part of the radical listening. Listen to women, hear what they're saying, address it by doing something concrete for women. And one of the issues that came out of that, which virtually replicated MAMMI study findings, was postpartum care. They had just scored really low all the time in most areas of the country. And so they implemented and they started with 5 hubs. And I'm delighted to say that I was invited to lead on the evaluation of the hubs, which is now finished just this June, and worked with postdoctoral researcher Susie Hannon on it as well. It was lovely. And with colleagues in Trinity on each of the sites. This momentum I've been talking about, this MAMMI study, the findings out there, the women talking about all aspects of their health and breaking the silence. So we were invited by the clinical director of the Specialist Perinatal Mental Health Services to work with them on beginning to look at the new and develop their new strategy, which was great because it's shaping what might happen in the future. The government and the Northside Interparliamentary Association then reached out and invited us to present to them on maternal health and maternal health in Ireland. And this is north-south, so there was people from the north and people from Susie and I from the MAMMI study. Now, I want you to reflect here. We were going in with the MAMMI study findings. Their agenda was slightly different in that, we knew it in advance. This was about the fact that there's no place for really seriously mentally ill women to go on the island of Ireland and keep their baby, keep them together. So there's no place for them. But you can also talk, and that's about 1% of Ireland, so we were able to talk about the other issues of mental health more broadly, and that was really, really good. And we had really positive feedback from all of the ministers. They did have a question, and that's about costs. And if I was to go back into that forum again, I would definitely have some more information on costs and cost of services. So is it making any difference? Well, here's the 5 sites. We've expanded postnatal care in the 5 sites. It's not just midwifery care, it's integrated care. So it's care between the hospital and the community, and it's this seamless flow. It's not yet in all, but soon to be in all 5 sites, women's health physiotherapy services. It's direct access and referral on to mental health, perinatal mental health midwives, other services. And I'm delighted to say that more recently, at the end of last year, that the Minister announced the extension of the sites. So this year we will have 9 postnatal hubs in the Republic of Ireland. Now it looks as if these are hubs, a site. It's not. So it's a hub, might be a clinic here on a Monday, here on a Tuesday, so there's more sites. And the more they get out in the community, the more women learn, this is for me. There's something else happening here that's worth noting, that's noteworthy, and that's those 3 hubs in the Dublin area. These hubs, the vision for this is that these hubs become a Dublin hub. So it's for the first time within the maternity service in Ireland, you will have a service that is for women, irrespective of where she gave birth. So it's a woman-centred service, not an institution-centred service. That's wonderful. And this is what it'll look like in 2026 when it extends to 13 sites. And that's policy. And that's, I would say, listening to women throughout and being constant, persistent, generating momentum, fostering relationships with practitioners and policymakers, being yourself, being authentic. But the critical thing to go back about this study is that it was a study with and for women. And it is changing services so that women's experience of postnatal services now are changing from women saying that they were invisible to, without it, the postnatal hub, I would have been quite adrift. Paloma, the support I got from the hub, and combined, I think it's the combination, public health with the hub, La Leis League and the hospital, all was a package that ended up giving me a lot of reassurance, support and care, and it was outstanding. And that was theme 2 that Susie identified in the What Works for Women study. Thank you, and sincere thanks to the women in the MAMMI study.
Thank you, Deirdre, for such an insightful and powerful presentation. I found very interesting what you said about women telling you you have to do something. I think that really shows that impact is more than the findings and publications, that they want to see some actions and benefit in their real lives, in their health. And so while I wait maybe for people to type their questions, I have a lot of questions for you. So maybe I'll start and give some time for people to start typing. So I think that from your presentation, what I think is important to influence policy is to have an engaged research approach. You mentioned several times that this was about women, involving women in the study being with women and not just about women, and also dissemination of findings. No, you mentioned like the media played a role in getting the findings out there. So we have engagement, dissemination. Will you think there's anything else there that is key to get to that change that you have achieved with your research?
I think, yeah, I mean, what I've tried to do this afternoon is tell that story, but there was an awful lot of building relationships and networking going on. So once I was doing the MAMMI study became, it's not mine, it became a team. It worked because there was a team. And initially that team included healthcare professionals and women's health physiotherapists in the various hospitals who distributed the survey. So you're engaging with them and you're sharing information with them. You're letting them know there's no information out there. And then the momentum and the findings start, and people like various committees who are concerned with maternity services will come looking for you. So you've this two-way building relationships. There's a lot of it at times, but it's so worthwhile, and it just takes time. And remember, I'm sitting here more than 10 years after the first study findings were published. So it has taken time and it's taken a while, and it's that persistence. Keep going.
So not to give up and
Yeah. But I think it's that get to know your both health service providers and policy implementers and policymakers.
And you mentioned in terms of the relationships, do you think that that was a good method in terms for you to achieve that impact? Any formal methods as well, like we're using policy briefs, or any formal methods that you think were also useful or you would advise people to do?
There was, yeah, and a lot of our colleagues do it. But what I would have done rather than policy briefs was we had some infographics and stuff, but we would have shared our publications and papers with them regularly. So there weren't policy briefs per se. We also had invited the department in several times to have meetings with them and to talk about this. So we've been talking about extended postpartum care with policymakers from 2016-17. And I think what was really useful is, and again, it's a tip for everyone, I didn't go into the meetings with, here's the problems, women's health. You also went in with what women described as potential solutions. That was key. You were giving them the answers they wanted.
Yeah. I think you mentioned that and how important it was to adapt the message as well when you said know their agenda. So when you're disseminating, when you're communicating the findings as well, adapting it to the different audiences and what they need.
Yeah, definitely.
So I think we have a comment there from Vivian Brady, just saying great work, Deirdre and team. Great to see the story unfold from a practice insight prompt at the very beginning to how momentum gathered to a collective effort to influence practice and at a structural level, from micro to macro. So yeah, I think that micro to macro, from starting from the women and gaining momentum to reach policy and all the hubs and that being extended.
Yeah, and I think, Luciana, it's important to say that another researcher's experience will be completely different. And they may very, very well be coming from a place of where they're generating research that's been requested or commissioned or stuff. This was landing on people's lap with no knowledge. It was creating that momentum that was generating, problems for the policymakers. They were going to have to do something. Others will have completely different experiences. So, but this was our journey. And I think it was the power of building a team and that team having the same philosophical approach that's reshaped postpartum care in Ireland, which now is becoming a beacon for the world.
And can I ask as well, Deirdre, in terms of, you mentioned engaged research and how important it was. We have advice maybe for any researcher out there that hasn't used an engaged research approach, and they think, oh, maybe how can I do now to get to influence policy if I haven't maybe involved, people from the start so much? Is there hope?
Well, I would say it's never too late to start.
Mm-hmm.
I think it is powerful. And I suppose it's all right for me. I was a practicing midwife and used to talking with women. But I had lessons to learn as well, because I was talking with women as a midwife, not as a researcher. And those two, I had to learn those boundaries. I would say to anyone new who hasn't done it, start by talking with someone who's doing it. Doesn't matter if they're completely different topic.
Mm-hmm.
Get
like
a glass of water, a cup of coffee, talk by, this is what I'm doing. I want to desperately try to engage. Where will I start? If you're in Trinity College, you have got the wonderful resources of Dr. Liz Vercassi and the PPI Ignite. I'm sure, and I know she was coming on the call or on the webinar, I'm sure she's there, but talk to someone that you know who's doing it. And start there and then say, can you help me think of ways that I could do it? Even if you're in a lab, you're in that lab researching something that's important to someone, a member of the public.
Thank you, Deirdre. We're having some questions and comments coming in. A lot of people say thank you, super presentation. There's a question there from Lorraine. Listen, can you say something about the work that goes in beyond the life of a funded project to ensure that the research findings make it into policy discussion? I think that the work required post-funding contracts is often not well discussed in academic funding circles.
Hello, Lorraine. Can you say something about the work that goes in beyond the life of a funded project to ensure that the research findings make it into? I think that the work required post-funding contract is often not well discussed. Yeah, I think it is. I mean, and it is. So this is what happens when a contract ends, a research contract ends. And Lorraine and I have just working on a beautiful one at the moment with deaf women and their experience of maternity services. And it's only now that the big work is starting, and it's what you do. And it's every opportunity you can to share the findings. And it's your philosophy. You have an ethical obligation and a moral obligation to share those findings and do it. That is your work. Yes, you're supposed to be trying to get new grants and everything else at the same time. But this is what's going to make the difference. I would also have to say, and Lorraine and others will know this, it's not about an individual researcher. It's about generating a team who will all have the same approach and do it together. And it's about keeping on at it and I've been in different fora and not related to, say, the MAMMI study or something else, and been asked about it. And it'll come up, as will the findings from the deaf women study. So it's keep doing it. And it's that, I would say, it's constant, it's relentless, but it's also respectful and building the relationship with the people you know who want to change services and make them better for women.
We have another question, Deirdre, from Hayley, and I think this probably resonates with a lot of early career researchers. First of all, they say this is really incredible work. Thank you so much for sharing. For a very beginner researcher, do you have advice on how to start networking with policymakers? And I think maybe a lot of people feel daunted by maybe start networking with policymakers. Do you have any advice on that?
Okay, so I would say who are your policymakers? Draw a mind map of them, Hayley. You'll have policy implementers and you'll have policy makers. I don't know what your specific area is, but you'll have policy implementers and you'll have policy makers. Know who's who and who's influential. and who's becoming influential in your particular area. If you have, and then what you do is, if you're doing your research from a very beginning researcher, so you're starting, see if you can engage with them, even for a short discussion or at a meeting they're at, to 5 minutes of their time to tell them about what you're doing and to seek their advice on. People love to be asked for advice, Hayley. So seek their advice on what's going to make a big difference to practice. What do the policymakers want?
Then we have other comments saying thank you from Kayla, and that's a very insightful presentation this afternoon. And Liz Farazzi has left her contacts, and maybe then that's the time for me to also announce our next seminar. But thank you so much, Deirdre, for a very powerful and insightful presentation. And to everyone, I'm just going to share the details of our next session. You can register through our website, and also I think we have the details there in the chat as well. So thank you very much, Deirdre, again. That was very, very powerful and very useful with practical advice, I think, for everyone. Thanks to all participants and everybody who attended. And thank you to Jenny and Elizabeth as well for all the technical support. And hope to see you then on the 2nd of October when we have our next presentation, Engaging with Policymakers. Thank you.
Thanks a million. Bye-bye, everybody.